welcome once again. You are watching Sunrise at Sea, and you're right in time for the wellness segment with me, Sandra Cope. Now, this morning on Wellness, we are at Bethany Women and Family Hospital, and I'm just about to talk to Dr. Helen Namusoke. She's a pediatrician here at the hospital, and this morning we'll be discussing ear infections on children and infants. Good morning, doctor. How are you?
Fine, Sandra. How are you?
I'm good, good. I haven't seen you in a while.
Yeah, your children have been healthy.
Yes, they have. I guess it's a good thing.
Very good, yes.
Now, this morning, I would like to shed some light, you to shed some light on ear infections. As we know, kids really suffer from ear infections, and mostly it goes undetected. I know I really suffered with this. I came to you all the time when my babies got that. So what causes ear infections in children?
Oh, so they are sometimes viral causes of ear infections. Sometimes they are bacterial causes of ear infections. Now, the ear is divided into three main parts. We have the outer ear,
Yes.
what you see on the outs, and that we call the external ear. That commonly suffers fungal infections, bacterial infections.
Like when it has the itching and
Yes,
stuff
the
around
itching, or sometimes it is analgesic irritation following like swimming. Yes,
from the chlorine.
from the chlorine in the
Okay.
swimming pool. And then we have the middle ear. That commonly suffers in children less than 2 years. They commonly suffer with bacterial infections. Sometimes it is a viral cause of infection. And then we have the inner ear that rarely gets infection.
That's
unless
where like the eardrum is, way up inside.
the inner ear is somewhere after
the eardrum.
after the eardrum. So unless if the eardrum is punctured, the infections rarely reach the inner ear.
Okay.
Yes. So
And how do they look like? Like inside, you know, when you look where the wax is, you see kind of maybe yellow stuff or something that shows.
so the normal eardrum should be shiny, brightly shiny white.
Okay.
Okay.
Yeah.
So one of the signs of infection is it swells, it begins bulging, and then it sometimes it turns dull, and eventually it turns red.
Okay.
So when we put in our otoscope or to look into the ear, we see a red eardrum. So that is a sign to show us it is infected, and that shows that there is an infection in the middle ear.
Okay.
Yes, and usually it goes from the eardrum to the ear canal.
Oh, that's where like the wax is and everything. That's the canal.
The canal, yes. So we find it is all red, so that is a sign to show us that there is an infection. Clinically, or on the medical perspective. But on the mother's perspective, usually the child becomes irritable because of pain. It's quite actually painful. So the child gets irritable, sleepless nights, restless. Sometimes they can even fail to feed.
Yeah.
And sometimes you see them tugging the ear all the time.
So that's a telltale sign.
Yes, usually the first telltale sign is they are tugging their ear because they feel something really is not going well.
Does it become worse at night? The aches?
I think because during the night the child doesn't have distraction, so all the concentration is on their body, so they ought to feel more pain than during day when they have several distractions in their environment. That's why I think, and also the mother is also concentrating on the baby during the night, so they are more likely to notice the signs and symptoms during the night than
is there any
during
discharge?
day. Sometimes they have, no, these ear infections, sometimes they resolve spontaneously without any treatment. But in the events when they have severe infections and they fail to resolve on their own, and if not treated, they can progress to form pus and sometimes even puncture the eardrum, and you see a pus discharge coming out.
So when you see pus, you know it has really escalated.
Yes, it's obvious it has escalated.
Oh wow. Wow.
Yes.
But how do mothers, because we always wonder how to remove that wax. Clearly, you can't put an earbud in the baby's ear. Is that
Yes.
advisable to put an earbud in the
No,
baby's
no, no,
ear?
no, 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 no. It is
Wha-
not advisable
what
to
should
put
you
an
do?
earbud in the baby's ear, because when you push the earbud,
It goes inner.
you're going to push the wax deeper. That is one. And then two, you're likely to puncture the eardrum. So you're going
it's
to
very
cause...
delicate. Even an earbud can puncture it.
Yes, it is
Oh,
that
wow.
delicate. Yes. So what I would advise to get a soft cloth, and you wipe the ear on that regularly to avoid accumulation of wax. Because a cloth is soft enough,
Yeah.
it's less likely going to puncture the eardrum. Yes, yeah. And these ear infections commonly occur when the child has a respiratory tract infection, that is the common cold and common cough and flu.
So it just escalates.
It's just because the ear, the nose and the throat are interconnected. So if there is an infection within the nose, chances are high that the child will either get a throat or ear infection.
Okay,
Yes.
that makes sense. Also, when you're washing like a baby, when you're washing like a baby, and after they bathe, yeah, sometimes the soap and some goes like around the ear. Can that, if it goes into the ear, can it cause infection as well?
Maybe, maybe not. If the water is clean enough and you wipe the ear
Right
very
after.
well right after, less likely that you have an infection. Yes, but sometimes when people keep reusing the water, like those who use herbal baths for a
Yeah.
baby, sometimes it is not clean enough. Yes, if the water is infected, it can cause an ear infection. Yes.
And what kind of medicine do they give when it has escalated? What kind of medicine?
Oh, when it has escalated, well, so basically when the child presents with signs of ear infection, I would advise a mother to seek medical help. For the clinician or a doctor to have a look at her ears using an otoscope and see what exactly is happening. Is there a past discharge? Is the eardrum punctured or not? How serious is this infection? And usually the doctor, depending on what they'll see, for children less than 2 years, we most of the time give them antibiotics, because we know even when it starts as a viral infection, most of the time it will turn into a bacterial secondary infection. So we tend to give them an antibiotic to take. And then, of course, we usually give them a painkiller like paracetamol or Ibmex, depending on how much pain the child is having, because it is quite painful. And then, yes, and then, of course, we advise the mothers to feed the child very well to make sure that they fight the infection.
What kind of foods would you advise?
A high protein diet is very good to
Like
build eggs, milk,
beans.
Yogurt, beans, yes. And then fruits also, they help to improve the immune system of the baby so that they can fight this infection. In the infants that the baby has passed, sometimes we tend to extract some of that pus, depending on how thick it is. And sometimes we use the eardrop, depending on assessment of the clinician. Yes.
If it goes untreated, like let's say it's too late, God forbid, for a mother, can it lead to deafness, to a child going deaf?
Yes. So if it goes untreated, what happens is it escalates to the inner ear. Remember, the eardrum gets punctured, and then this pus can escalate to the inner ear and infects the inner ear. So that can lead to a number of complications. Either the inner ear is mainly important in the balance, body balance, how you stand and you balance. So a child can get issues with their balance because of infection in the inner ear. It can also affect hearing, so it can eventually lead to hearing loss. Sometimes it can actually proceed and reach the brain and cause what you call a meningitis, and that is life-threatening.
Wow. Wow.
Yes.
So that's why it is so advisable to have your child immunized against meningitis. With that, is it meningococcal?
Yes, so it is advisable to immunize your child against the common infections. For example, Haemophilus influenza, which they get at 6 weeks, 10 weeks, and 14 weeks. Influenza vaccine to avoid so many episodes of flu and cough. And then also the meningococcal vaccine to protect them against meningococcal meningitis.
Wow.
Yes.
Thank you, doctor. That has been so insightful.
Oh, welcome,
Thank
Sandra.
you so much.
Thank you. Hope you will take better care of the boys.
Oh, absolutely, absolutely.
Okay.
And I hope you mothers have been listening to Dr. Helen Namsoke here. She's a pediatrician at Bethany Women and Family Hospital. And today we have been talking about ear infections, how to detect them, what causes them, how to mitigate this at home as a mother or a parent, what they should eat, what they should not eat, what they should do, and if it escalates, what to look out for, you know, because your child could have hearing loss, which is the least of your problems, because they could also get meningitis. Well, that is why actually you should immunize your children. Immunizations are very important for these young children. So make sure you immunize your children. Well, that is all we had on the wellness segment this morning on Sunrise at Sea with me, Sandra Cobb. But do not go away because we have quite a lineup for you.